time for us to talk health, and to do justice to that is Dr. Lanre Olaitan, an emergency medicine doctor based in Manchester. He has a Bachelor of Medicine and Bachelor of Surgery from the University of Bristol. He also holds a Bachelor of Science degree in pharmacology. Now, Dr. Lanre is also the co-founder of the venture capital-backed medical technology startup MedCircuit. And today, he'll be talking about the types of breast diseases. Great to have you on the show with us.
Thank you.
Very well.
Pleasure to be here.
Okay, so let's head straight to the topic for today, talking about breast diseases. Now, I'm pretty sure there are quite a number of breast diseases. Could you break them down for us?
Yes, so when we talk about breast diseases, we mainly mean breast lumps and breast infections. Those are the two broad areas of breast diseases that we mean. And when we talk about breast lump, we'll be talking about cancer, we'll be talking about other breast lumps which are non-dangerous at all, which are just very, very normal. And then breast infections, which are basically infections of the breast that can actually make you quite unwell and quite ill. So those are the main sort of broad aspects that we're talking about.
Okay, so we've talked about breast lumps, and then we talked about breast infections. Now let's start off from breast lumps, okay? So when we talk about breast lump, what different areas can we put under breast lump? Because most people think breast lump just simply means breast cancer, but it does seem like it might mean some other things. Could you shed more light on that?
Yes, of course. So when we talk about breast lumps, breast cancer, of course, is the most dangerous and the most important thing to consider. So I think I want to just make it clear that if you have a breast lump and you're concerned, it's very, very important that you seek help from a doctor. That's the first thing to say. But not all breast lumps are the same. Not all breast lumps are cancer. So you can have breast lumps. Some women, for example, every month during their menstrual cycle, they get lumps in their breast. That's normal, okay? So that can happen, and that's nothing to be concerned about.
Okay. So if it's during the cycle, it's absolutely normal. However, when do we start worrying about it being possibly abnormal?
So I think it's very important that every woman in Nigeria should check their breast, every single week. So every single week, just feel your breast to make sure that there's no new lumps there, because then you know what's normal for you. And if you know what's normal for you, then you can tell when something's abnormal. So if there's a new lump that you feel, then you should seek, and it's not going away, then you should seek help. If you notice any lump that is not changing, or if you notice any lump and there's other sort of changes on your breast. So for example, there's you notice sort of pain in your nipples, or your nipple changes shape. That's a very common one that people don't realize. That sometimes you can have your nipple change shape, and the breast lump will be so small that you actually can't tell that it's actually something to be worried about. So if you notice any changes in your breast, you should seek help. But you should get to know your breast as well.
Okay. You mentioned after a few days, if you don't see any difference. Now, say, for example, for someone who probably has not been checking their breasts for, ages, and then the person does so now and sees something suspicious, does it mean the person should still wait a few days or going to see their MD immediately?
So if you notice a breast lump and you're worried about it, you should definitely seek help, because it's best to seek help and be sure, and then you can then observe it rather than just keep looking at it for a while and just being worried and causing yourself a lot of mental health problems because you're concerned about this breast lump. So I think if you see a breast lump and you're worried about it, first of all, you should seek help.
Okay.
Yeah.
So first of all, seek help. Now, we've established cancer. We've also established that there might not be so many things to worry about when it comes to a breast lump. Now, besides cancer, what else should I be worried about if I observe a breast lump?
So one of the most, apart from cancer, also if you get a breast lump, apart from cancer, other things that you should be concerned about is, there's things, it's called a fibroadenoma, which is a fancy term, but actually it almost means a breast mouse. So if you see a lump, and you need to see how much it moves in your breast tissue. So can it move that well? If it's cancer, it won't move very well. It will be very, very structured, very, very, laid down. But if it moves a lot, and you can move, and it moves around your breast a lot, then it's called a breast mouse, and actually it's nothing to be concerned about.
Okay, that's great. Okay, so we've talked about breast lumps. Now let's talk about breast infections now. What breast infections are there?
So broadly, there's one called mastitis, which is basically infection of the breast tissue itself. It's quite common for women that are breastfeeding,
Okay.
but if it's not treated, it can actually form an abscess. Also, women who smoke can get something called a breast abscess, which is a pocket of infection in the breast that can be quite hard to treat actually. So smoking is a very big risk factor for getting breast infections, and breastfeeding is a risk factor for getting mastitis, which is another kind of breast infection.
Okay, but the one caused by breastfeeding, it's
Yeah.
not so easy to treat, or it could
No, no, no.
degenerate. What?
I
How do
mean,
you fix it?
so that's quite easy to treat. You get antibiotics and they'll treat it quite easily. It's not a big problem at all. So it's the one that's caused by smoking that's quite hard to treat.
Is it caused by a suckling child that has teeth? Is that the cause,
It's
or it's something entirely different?
entirely different. It's just the breast reacting to the suckling from the child, yes. But it's
Okay.
not the teeth that actually cause the infection, no.
Ah, so because sometimes, when the nipples are sore, there's that fear that, oh, it's probably, the usual talk is, the child is probably biting while suckling or something. So that is not actually the cause of those sores, right?
No, no. So the cause of the sores are actually cracked nipples. So
Okay.
when the child is sucking on the breast, they suck so hard that the skin of the nipples actually break.
Okay.
It's like just having it's almost like having a wound on your
Yes,
skin. That's
yes,
exactly what it is. Yeah.
yes. Okay, so do you then put maybe Vaseline? But if you put Vaseline, would it not affect the child while the child is suckling? How do you fix such, like quick home remedy?
So yeah, Vaseline really helps because Vaseline just helps make a barrier across the skin so that actually it doesn't break anymore. So it will just mean that the skin can start to heal. And Vaseline is essentially harmless. It doesn't affect the child at all.
Okay, okay.
Yeah.
So for breast infections, yeah, at what point do I need to see my doctor? Because there are some of these things that sometimes might be observed and one does, just doesn't take note of them. So at what point should I see a doctor? If and what should I observe that will make me know that, okay, there's trouble in the air?
So the main one is, you need to seek help. So we have an app called Privadoc, which allows you to consult with a doctor anytime, anywhere you are, in the middle of the day, in the middle of the night, anytime you can consult with a doctor. And what we
Okay.
find is that it's best to seek help when you have the breast pain, and you
Breast pain.
have maybe
Okay.
you start feeling hot, or you start feeling warm, or you start feeling tired. So those are signs of infection.
Okay.
If you notice any sort of discharge from the breast as well, so anything like oozing, which might look quite watery, or it might
Okay.
look like pus. So anything of the sort, then you need to seek help from a doctor
Okay.
as soon as possible.
Okay. So are there ways to prevent this? It's one thing to find treatment, it's another thing to actually prevent it. There are certain circuits that talk about, okay, for example, breastfeeding actually helps prevent cancer or reduces your chances of, contracting breast cancer. So what other ways can we prevent breast infections, breast diseases in general?
Um, I'll just touch on the point you mentioned about breastfeeding actually preventing cancer. That is true. That is very, very true. But the biggest protection against having breast cancer is actually having a baby early. So women who actually have babies early, actually they get protected from having breast cancer quite drastically compared to people who don't have children. So that's quite a big thing. Now, to talk about preventing infections in the breast, the biggest one is good hygiene and not smoking.
Okay.
And it sounds quite simple, but those are actually quite important things. So being,
Wow.
washing your breast regularly, washing your body regularly, and not smoking, or avoiding people that smoke actually makes a big difference to you getting breast infections.
Okay, so hygiene is important as well as not
Hygiene.
smoking. Good hygiene. Okay, I just want to quickly ask one more thing. You mentioned the fact that having babies early could actually help. That's, of course, not just having them, but also breastfeeding the babies. So when you say early, what age range are we looking at?
So from mid 20s onwards,
Okay.
is advisable. So that's something that actually helps just protects you from having not just breast cancer or other kind of cancers as well. It protects you from that as well. So it's something that I think that obviously you can't force yourself to, to have a child early, but
Yeah.
if you do, then it's beneficial for you.
Okay, so from 25 is okay, right?
Yes.
Okay, so from 25, it's perfectly fine, and it helps prevent breast cancer as well. That's really fantastic news. I'm really pleased to know about this. So the most important thing we've learned today is when you feel any kind of pain or you feel anything different about your breast, you should see a doctor, right?
That is correct.
Yeah. Okay.
Yes.
One more thing. You know, when women are pregnant, they experience changes in their bodies. Now, sometimes some women don't even realize that they're pregnant yet. So, if you find certain things in, you know, certain changes, and you happen to be pregnant, but it turns out not to be pregnancy related, how then do you get help for such, especially if it might affect the child?
Sorry, if you come again, I don't understand the question.
Sometimes when you're pregnant, there are body changes, especially to your breasts. You feel an expansion and all. Now, for somebody who probably starts having those symptoms of breast diseases at about the same time the person gets pregnant, will seeking help affect the child or not?
No, absolutely not. So, I mean, you can always seek help. The very important thing is that when you treat breast infections or breast disease, normally it doesn't affect the child at all. It doesn't affect your pregnancy at all. It's completely safe. Most antibiotics doesn't cross to the placenta to affect the baby. So that's something that is very, very important to actually get the help you need and get the help early on. And don't be worried about the baby, because actually, you know,
all right. Thank you
safe.
so much for your time, Dr. Lanre Olaitan. Thank you so much. So basically what we've learned today is no holds barred. If you are having any form of discomfort in your breast, just seek help. It doesn't matter whether you're pregnant or not, just seek help. We'll take this break, and of course, we'll be back with more on Wake Up Nigeria. Stay with us.